Hello, and thank you for selecting Summit Surgery and Recovery Care Center for your surgery. This video will introduce you to our team of professionals, our facility, and walk you through our surgery process. Our mission is to give patients a quality patient experience unlike any other.
Patients have a lot of anxiety about their surgery, and that's normal. And our goal as soon as they come in is that we make them feel at ease, help them to relax, help inform them about the whole process from start to finish in terms of what they're going to go through and what to expect.
Patients who know what they're in for and what the risks are and what the normal post-operative course is tend to have less anxiety and tend to do better. The most important thing is that we really communicate and educate our patients quite well.
These are some of the best people that you will ever meet. They're very knowledgeable and they're very good at what they do. We know how to take care of the patients that are receiving those surgeries because we do them so very often.
We've attracted some great physicians, providers, therapists, surgeons, physician assistants. They are all under one roof and they all could be anywhere, but we love Flagstaff, and it really does attract a quality that is hard to find anyplace else.
We would like to take this time to explain each step of the surgery process and to answer questions you may have. Step 1 is preparation.
Most patients are very nervous to come in here. The first thing they do is go meet with the pre-admit nurse. So that could be days or even weeks before your surgery.
That nurse is going to go over all of the doctor's orders that he's written regarding your surgery, what he's going to do and what equipment he's going to need and so forth, how long the surgery is going to last. All of those orders are going to come down to us. We're going to review those with you. We're then going to obtain your health history so that we make sure we know everything we need to know about you to make this as safe an experience as possible.
Pre-admit really is key because that's our screening process for your safety and health. And it's when we give you instructions what to do the day before surgery.
So those are things that we talk about and get all figured out even before the patient comes in for surgery. So we go over your entire medical history. If the anesthesiologist or surgeon wants to order any testing, then we do that. All the records are reviewed, they get cleared.
It helps to bring, your information about your health history, a list of your medications, because we do need to know all of that beforehand. And then we're going to go through a set of instructions on how to prepare for your surgery. So when you need to stop eating and drinking, if you need to change any of your medications before surgery, that type of thing. We're going to discuss all of that before you leave and answer any questions you might have regarding the surgery. Kind of just walk you through that whole process again.
A lot of the doctors will give the patients prescriptions ahead of time. And it is easiest if you get those filled. That way you just don't have to worry about that after surgery.
What if I'm unable to meet with you in person?
If you don't have the ability or time to come in and talk face-to-face to the pre-admission nurse, there is an online site that we can give you that you can go in and enter all of that health history from home. It's pretty convenient because you've already got all your doctor's numbers and your medications and everything at home. And then we can call you. So once we get that information, we can call you and have that conversation over the phone with your health history already there and just review things.
So we can answer a lot of questions during that process and try to put patients' minds at ease.
What about eating and drinking?
Before surgery, you're going to have to stop eating and drinking, and that's something that we go over those instructions in the pre-admit area. So stopping eating and drinking, changing some of your medications.
Leading up to surgery, it's great to be hydrated, but patients are nothing by mouth after midnight the night before surgery. There's certain medications we want you to take, certain ones we don't want you to take. And it's really key that that information and education gets out to you.
Arriving to the surgery center about an hour and a half prior to your surgery, and you check in at the front desk. They do accept at that time whatever your co-payment would be. And then the preoperative nurse comes out and gets you and brings you back, gets you into a hospital gown.
The pre-op nurse, it's one-on-one with the patient, and we do everything we can to make sure they're comfortable, put their minds at ease.
Reviews some of your history, reviews, whether you've followed the instructions, gets your vital signs, blood pressure, temperature, all of those. And they'll start an IV access on you there in one of your arms so that we can give you medication for surgery. Your family can be involved in all of this level of care. We can talk with the family beforehand, The day of surgery, they're welcome in our area to be sitting with you while you talk to your surgeon, talk to the anesthesiologist and so forth. You know, your family is more than welcome to be present.
And it's the anesthesiologist that's going to discuss with you how deeply asleep you want to be and how you will feel no pain and wake up with minimal pain and minimal nausea.
And they'll go over the pros and cons, what they plan to do and why, what you can expect to feel, what you can expect to not feel.
Honestly, the biggest fear that I hear from patients every day is that they are scared of getting an IV. Most patients are more scared of that than even the surgery itself. So our nurses are extremely skilled. We do this all day, every day. Most patients leave and think, wow, that was a great experience. We hear compliments all the time from patients.
Of course, you need to have a driver with you because after surgery, you're not going to be as coherent as you might be. You might not remember a lot of things because of the medication that we've given you for anesthesia or pain. And so we like to have a family member or friend there that we can talk to after the surgery to go over your discharge instructions. So you've got somebody kind of in your corner when you're going home that knows what's going on.
They may have problems with having somebody be at home with them for 24 hours, which is highly recommended after any surgical procedure to have somebody with you. We're really good with language barriers. If you don't speak English, we're pretty good about having a family member help us translate, and for some of the pain management procedures, they can even come back into the operating room with you.
Operating rooms are cold. We will put some warm blankets on you before you go back. It's chilly in there for a reason. There is going to be a lot of things they're going to be talking to you about. We want you to move here, we want to move this arm there, we're going to do this here. And so people are kind of coming at you from all directions, but everything they're doing is kind of like an orchestration. They all have their roles, they're all watching out for you. You know, surgeries last anywhere from 30 minutes to 3 to 4 hours. When you're ready to come out, when the surgery is done, the operating room calls out and lets the recovery area know, we're going to be bringing this patient out and we've got all your chart and information ready there. And so the recovery room nurse is greeting that operating room nurse and the anesthesiologist. They get a report from them so they know exactly what's going on during surgery, how you've responded to it physically, whether your blood pressure changed, whether they had any difficulty with any breathing apparatus or anything in there. So that recovery room nurse is very familiar with what's happened to you during that surgery, and they begin the process of waking you up. Recovery area is typically, I would say, about an hour to an hour and a half. Usually you wake up within that first 20 minutes, and then we're kind of, like I said, evaluating for pain, nausea, other problems in the next 20 minutes and bringing your family back. And then we go over a set of discharge instructions that we've gotten from the surgeon, what he needs you to know about going home. And we kind of practice getting you up to walk, making sure you're stable on your feet, usually giving you some juice or crackers or something like that to check and make sure your stomach's doing okay. And as I said, we go through a full set of instructions before you go home. So you know when you leave here what you need to do, what you need to be careful about, what it's okay to do, what it's not okay to do, things like that.
We're going to give you instructions if you need to get to class, if you need to get up and down stairs, if you need to be returning to work. What are your limitations? What are your range of motion abilities following surgery? The surgeon will tell us specifics to your discharge instructions, and we are proficient in making sure you understand that before you go home.
We're going to have numbers for you when you go home. One number is for the doctor on call, so there is a physician on call 24 hours a day for the facility, and you'll have that number to reach. And also a nursing resource line that if you just have some nursing questions, gee, I got a question about my dressing, or I don't remember what they told me about my sling. Am I supposed to wear it all the time or not? So you can call back with nursing questions, and also the staff will call you the next day because we want to check and see how you're doing the day after you've gone home. Make sure that you don't have any questions, that there's nothing, that you're concerned about, that everything's going well in your recovery. Part of our whole idea is to make you as well as you can to live the life you want to lead. And so we've got this process down pretty pat.
This group of people that works here, we all work so well together, and this feels like a very low-key, low-stress environment.
And I don't like to be injured. I don't like to be in pain. And I know that other people don't either. I think it's nice to be able to help people to return to their quality of life.
Not knowing is what leads to fear for the most part. So if I can impart some information and knowledge and a little touch here and there that gives them that confidence, they're going to come through it a lot better and feeling good about it.
It's like a 5-star resort. Everybody's coming and they're glad to see you. They're happy to see you. Look at it. There's always, everybody in here has a smile on their face. No, everybody's happy. Yeah, what's not to like?
Thank you for selecting Summit Surgery and Recovery Care Center. All of us are committed to providing you and your family the best experience possible and helping you return to a healthy life.